Hi, you guys. Welcome back for our daily practice questions. As always, you know I like to get into my disclaimer and introduction before starting with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review books, review courses, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to work with you as well if needed. Now, my disclaimer reminder is that there's no absolutes in medicine. We know that, and we treat on a patient by patient basis. So, when looking at any of these questions, just remember that I have designed and created these based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of the videos, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. Question number 1 states, a patient presents to the office today with complaints of fatigue. Their hemoglobin and hematocrit are low. Upon examination, the nurse practitioner notes changes in the patient's gait and inquires how long this has been occurring. The patient mentions over the last couple of weeks what type of the patient mentions over the last couple of weeks. What type of anemia should the nurse practitioner consider for their differential diagnoses? Is it A, iron deficiency anemia, B, thalassemia, C, B12 deficiency anemia, or D, folate deficiency anemia? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first. So that allows you to slow down and ensure you're answering what is even being asked. So here the stem of the question states, what type of anemia should the nurse practitioner consider for their differential diagnoses? So here, what's going on? Because if we're looking for a diagnosis, we got to run it back and see how the patient has presented themselves. We are looking at for our assessment findings, right? So subjective, what are they saying is wrong? What do they come in complaining of? And objective, what are we as the providers have found or finding or assessing on exam, right? So that patient came in, they were complaining of some fatigue, their hemoglobin and hematocrit were low. So, we're thinking anemia. Upon exam, the nurse practitioner notes changes in the patient's gait, inquires about how long this has been occurring, and the patient states that over the past couple of weeks this started, okay? So when you start to think of anemia, I want you to think through the whole picture. And I always say this, walk yourself through it. So if they had those key identifiers, know it. So is it iron deficiency anemia? No, we don't typically see change of gait with iron deficiency anemia. When you think of change of gait, neural deficits, paresthesias, beefy red tongue, that is B12 deficiency anemia, okay? So here, the best differential is C, B12 deficiency anemia. Again, iron deficiency anemia, we know we have things like the spoon-shaped nail, they may have some pica, things of of that nature is what you would commonly see as key identifiers for that. Thalassemia, they don't have as much subjective style findings as well as folate. It could be secondary for folate deficiency anemia as well as B12 to alcoholism, but folate typically doesn't have those substantial identifiers. So if you're seeing things like this, you need to pay attention to those ones that have those classic presentation style signs and symptoms. Question number 2. The nurse practitioner has B12 deficiency anemia as a differential diagnosis. How should she anticipate the red blood cell size and color to be? Is it A, microcytic hypochromic, B, normocytic normochromic, C, macrocytic normochromic, or D, microcytic hyperchromic? Take a moment and tell me what you got in the comments, you guys. All right, so you just need to know how these things present, right? And if you struggle, go check out my anemia video where I teach on my 2-1-2 rule, because there's 5 common anemias, and we group them based off of these lab values, which shows us the way the red blood cell size and color are, right? And so with B12 deficiency anemia, that's in the lower two. So in my 2-1-2 rule, the ones that fall into that larger range, the two that fall there are the B12 and folate deficiency anemia, right? And that's in that larger scale, that macrocytic normochromic. So C is your answer. Remember, microcytic hypochromic is your iron deficiency anemia and thalassemia. That's the first two in the 2-1-2 rule. The normocytic normochromic is your anemia of chronic disease. That's the only one that falls in that. And then the last two in the rule is your macrocytic normochromic, and that's your B12 and folate deficiency anemia. So here, C is your best answer. And lastly, y'all, for today, question number 3, the diagnosis has been confirmed as B12 deficiency anemia. So what is the best treatment? Is it A, ferrous sulfate, B, folic acid, C, B12 injections, or D, blood transfusion? Take a moment and tell me what you got. So it's asking about the best treatment for B12 deficiency anemia. Y'all, the answer is C, B12 injections. We know we do ferrous sulfate, 325, TID for iron deficiency anemia. Folic acid is for our folate deficiency anemia. B12 injections are for our B12 deficiency anemia. And our blood transfusions can be utilized when needed and warranted for our thalassemia, okay? All right, you guys, I just kind of wanted to work through some of these with you guys. I was doing our live practice questions in my 5-week review course, and I had done some questions in a couple of my sessions for my one-on-one reviewers today, and we were hitting on anemia a lot today. So I was like, you know what, let's do a little bit of anemia for you guys and walk all the way through one of them. So I hope y'all found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. You guys, make sure you're subscribing. I had a few of you reach out to me and you talk about my questions and you're trying to funnel through them. If you subscribe, it is free to subscribe, but you will be notified when the new videos come out. So you're able to just get the daily alerts of when they're posted so you don't miss any and you can work through and test your knowledge, okay? But make sure y'all meet me back here as always. And if you need any of the things that I offer, my review book, ebook, and paperback option are both linked in the bio of this channel. My self-paced review course that is designed for family and adult general nurse practitioners who are taking both exams, ANCC as well as AANP, is also linked in the bio of this channel. You're able to watch those videos on each system as many times as you would like. And then as mentioned, the 5-week review, we're currently in week 2 of that, headed into week 3. So just be on the lookout of the next up and coming one if you are looking to join my next group 5-week intensive. And then those one-on-one sessions, those are customized. They're broken down by either weaknesses, exam readiness assessments, or a custom plan to work alongside with you if you have been unsuccessful previously. So I always say give us a call or shoot an email so that I can adequately gauge what you need. You'll have to do that initial contact before getting that set up so that we can design and customize it based off of what you truly need. So give us a call at the nursing studio at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. As always, make sure y'all meet me back here. Happy studying. Bye, y'all.